introducing Dr. Brittany Lamb, emergency medicine physician. So, Brittany, working in the ER seems like an intense and stressful job. What made you want to take on the side business of supporting caregivers?
Yeah, so it's not a surprise. I talk about this quite openly that I don't foresee myself staying in the ER until I hit retirement age. I think most ER doctors have an exit plan, whether that's just saving up money so they can leave early. But for me, I saw this problem over and over in the emergency department. People who are aging and then their decision makers, family members usually stepping in to have to all of a sudden be their advocate, be their voice when they're not able to speak for themselves. And it oftentimes feels like people don't have a plan. They don't know what to say, what to do. They're not ready. They're not prepared. And for people who are living with dementia, no one wants to be diagnosed with a disease causing dementia, but one of the things about it is that we can look into the person's future, and we do know that it's expected that they will lose the ability to make their own medical decisions. So I thought, well, why don't I just teach their decision makers how to plan for the big decisions that they're likely going to have to make from a medical standpoint, so it's less stressful.
And that's so wonderful. I read that on your website, and you're like, yeah, once you know the disease, you kind of know what goes along with it and what one can expect. But if you're living it for the first time, you probably don't. It's all new and you don't know what you don't know. And I know it's your goal to help people make confident decisions. What does the caregiver need to do or understand to be able to make confident medical decisions?
Yeah, there's several things that I recommend that people do, and one of them is really checking into what your person's values of quality of life versus length of life are. And that's something we all really should be talking to our family members about. So for most of us, our goals when it comes to healthcare are to live and to live with good quality of life. But a lot of people do value quality of life more as they're aging, and when conditions, physical limitations, diseases causing dementia are affecting someone's quality of life on a day to day, they tend to start to value that more. A lot of people hold that as a strong value. And so actually defining what that means to the person so that we can make medical decisions based off that, because we look at how someone has been living. Have they been living with what they would say is good quality of life? And with whatever medical situation is going on, is it likely that they're going to get that quality of life back with the different treatment options? And so people can learn that ahead of time. The other big thing that's important to do is actually take inventory of the person's medical problems, because when you actually look at what somebody has been treated for and has been diagnosed with, and things that we're managing now, things that we've managed in the past, it helps you see into the future. And then that gives you a window of an idea of the decisions that you're going to have to make. And it's, I think we ask people to do things like advanced directives and get your affairs in order, but we don't teach people about the actual treatment decisions that they're likely going to have to face. And so that's gathering the medical history and really looking at all of that helps set you up for really learning about treatments and becoming informed from that standpoint.
That's true. You're not really taught those things. I'm trying to think where you would go to get that information, and it's really up to you to seek it and to find it out. You're listening to the Empowered Caregiver, and I am speaking to emergency medicine physician Brittany Lamb and founder of Brittany Lamb MD. You mentioned on your website various medical forms that caregivers should familiarize themselves with. Could you just give me an overview of what some of those forms are and how they differ from each other?
Yeah, so there's advanced directives, advanced healthcare directives, which tend to fall under the legal umbrella. So these are documents that tell us who a person would want to make their medical decisions. And it gets a little bit confusing because every state has its own language. But basically, you look for documents that say who someone wants to speak on their behalf when they're no longer able to make their own medical decisions. And then there's also documents like Living Will, Five Wishes. It might say Advanced Healthcare Directive, Advanced Directive, that actually talk about someone's treatment preferences. Okay, so what kind of care they would or would not want. That stuff, people have to have the ability to make their own decisions. They still have to have what we call capacity to make decisions in order to do those documents. You have to do them for yourself. No one can do them on your behalf. Then there are medical order forms like the do not resuscitate form, the do not intubate form, and the POST form. Okay. And POST has different names in different states as well. But basically, those are forms that are signed with a medical professional, and they directly turn someone's goals and preferences toward treatment into an order that can be followed by medical professionals, including paramedics. So 911 first responders can respond to medical order forms. They can interpret them and act upon them, but they cannot do that for advanced directives. So those are kind of the highlights of the forms that people should be aware of.
Well, I'm glad that they're in place, but even just hearing about them slightly sounds overwhelming. Where does one go if they want to educate themselves on these forms?
Yeah, there's all kinds of services and educational resources if you Google these things. I do write about them on my blog, and my blog is all geared towards dementia decision makers. But if you go to blammd.com/blog, I have an article about issues that I have with the living will, like practical issues with it, and also with the do not resuscitate. And there's a lot of information in there about like what these forms do and do not do. What I want to stress to people is that the documents are tools, but they're not actually a plan. So in order to really have a plan for the decisions that you're going to have to make, you really have to look at the person's medical history and think about them as an individual. But you need to read the documents that you have access to. Um, Other ways to get help are with estate planning attorneys, elder law attorneys. They help draft some of the legal documents. And then you can go to your person's doctor and say, look, I want to learn more about the do not resuscitate, the do not intubate, and the POST form. And I will say that POST is not widespread in use in all states in the United States. There are some states that have a very robust program and they use it, and then other states that do not. So if you
What
talk
what
to
do,
the doctor,
what does it mean? What I'm just curious, the Paul.
yeah, so it used to stand for something and now it doesn't. So
Oh,
they changed it. But physician orders for life-sustaining treatment. And I think part of why they changed it is, now we have a lot of nurse practitioners and PAs that are also able to sign these forms. So saying physician isn't necessarily the truth, but orders for life-sustaining treatment is what physician orders for life-sustaining treatment is what it used to stand for. And now the national program of POST, which there is one national form that they're just using the word POST now. They don't want us to use an acronym. So
okay. How do you spell it?
POLST.
Okay.
And
All
it has
right.
a website. You can read about it on the website. Yeah.
Sounds good. I will put that on my to-do list. You know what? I am going to ask you a question. I said I was going to ask you questions that you could just answer in your sleep, everything that you know. And I thought of a trick question for you, and
Okay.
that is, I'm curious. The state of Wisconsin is one of 5 states that have not implemented the CARE Act. And the CARE Act, and I think that's another one that goes by different names in different states. Really, it has 3 goals. It is to identify the caregiver, to make sure that the caregiver actually I'm thinking now what the number of them are, but basically what it is it's for the hospitals to identify the caregiver, notify them of upcoming discharge. That was the
Mhm.
other one. And then make sure that they have the understanding and I'll say understanding. Some states I think expanded on that understanding and like linking them to resources. But all we were asking in the state of Wisconsin, as we're advocating for this, is that the caregivers have an understanding about the care needed for their loved one once they leave, so they feel like they can be confident to take on that role. And so in our state, the Hospital Association says, "Heck no, not doing it." Well, what they're saying is that we're already doing it. You don't need to, you know, um, kind of regulate us further by putting this into law. So I'm
Mhm.
just curious if this is all new to you, Or in the emergency room setting, do you identify the caregiver and make sure that they understand what they need to do really when they leave?
So I wish I could tell you yes, but no. I mean, so I think what and I need to learn more about this, but hospital discharge is a little bit different than leaving the emergency department. So
Sure.
when you have an inpatient stay, there it's a little bit different than when you're in the ER. But no, I don't think that there is a coordinated effort from emergency departments to make sure that the caregiver has what they need. I think it's going to be very dependent upon the ER that you're receiving care in. So
Yeah.
we have very good social workers where I work, and they help with all of that stuff. But
That's wonderful, and I'm sure that many, many of them are great in doing what they should and can do, and there's a few that need improvement. But you're listening to the Empowered Caregiver. I'm your host, Liza Hellenbrand, and when we come back, we're going to learn more about how we can proactively be prepared to support our loved ones in the medical setting so that we can ensure the best care and honor our loved ones' wishes. Easier said than done. You are listening to The Empowered Caregiver, and I am your host, Liza Hellenbrand. Today I have two wonderful guests with me, Dr. Brittany Lamb, emergency medicine physician and founder of Brittany Lamb, MD. And then coming up shortly, I will be talking with end-of-life doula, Allison Ronning. So, with me right now is Brittany Lamb, founder of Brittany Lamb MD, which supports caregivers in being prepared to take care of their aging loved ones with a focus on caring on those with dementia. Brittany, you could probably speak to just this for the whole hour, but how is caring for someone with dementia different?
oh gosh, it's very different because there's so many issues with communication and processing. I think there's so much that we kind of take for granted about what our brains actually are doing for us on a day to day. Safety issues, and making medical decisions and being in the healthcare setting. A lot of the things that we do to people, they're uncomfortable, and it's not, it doesn't feel good, but we're doing them for a reason. A person living with dementia may struggle to understand that. And so it can
Mm,
really be hard to provide them care. And it requires a lot more patience. And that's something that's often lacking in hospitals. And so there's a lot of advocacy that is needed, unfortunately, for people living with dementia, that comes from oftentimes from their families, and so it's much more complicated. It's much more complicated to make medical decisions and to provide care, especially after someone has really lost capacity to make decisions and then also to communicate like they normally would have.
I can totally understand that. And, I've never Uh, I haven't yet been in the position where I'm caring or supporting elderly parents. I have two sets of parents, so mom, dad, stepmom, stepdad. So I'm sure I'm going to be getting a lot of that experience down the road. But my personal journey is I have a son with autism, so that's what led me to the empowered caregiver. And as you were saying, explaining some of that cognitive decline, it just made me think about when he was a little kiddo and I would go to take his haircut or get his haircut, and he
Mm,
would just scream because he would I think what he was thinking is that we were taking off parts of his body. You know what I mean?
mm,
So I can see how that can be really scary and confusing when you're in the state of mind that these things just aren't always making sense.
mm.
So well, I'm 100% on board that being a proactive and prepared caregiver is key. But one thing that I think a lot of people struggle with is how to start this conversation with your loved ones. How can you or can you speak to that?
Yeah. So one, I do have an article about this on my blog. When I talk about goals of care, that's kind of the conversation that needs to happen. But goals of care and planning. So you can go to my blog, blammd.com/blog, and scroll down, and you'll find an article on that. But the conversation project is another good resource. from my perspective, it doesn't matter if the person still has the ability to make medical decisions and have the ability to weigh in on a conversation like this. If a person can't do that, you still have to do this work on their behalf, kind of determining what quality of life means and determining their values. But if you're trying to go to an aging parent or someone that you care about who you're going to be speaking for, it really depends on your relationship with them. You can be direct with them and say, hey, look, I'm going to be the person that's stepping in to make decisions for you. I want to make sure I do what you would want. I don't want to live with a regret or a mistake like for the rest of my life that I did something that you wouldn't have wanted. Like it's going to fall on me. You can also blame doctors and say, hey, look, I was listening to this doctor who said that, it's really important to talk about quality of life and to start thinking about these things because it's a matter of when. We are all going to have situations in which we cannot speak for ourselves and cannot make our medical decisions. It's just a fact of life. So I think sometimes being direct and telling people that, you don't want to make a mistake and that it's going to fall on you, maybe guilting them a little bit. I know that
I
that
can do
might
all
sound
of
bad,
that,
but
Brittany. I can do all
yeah.
of that. I can guilt, I can be direct, I can be rude, I can be crude. No, I don't think that part's necessary, but having the conversations definitely are. And so you actually, if I'm understanding this correctly, created a whole program that you can purchase on your website, blammd.com, to support caregivers. Can you tell me a little bit more about that program?
Yeah, so I basically walk people start to finish what this role is, what the job entails, and give people the support and tell people about all the different services that they're going to need along the journey. Because I basically teach like what happens to a person from a medical standpoint when they're living with dementia, the medical issues that happen, the different treatment options, the treatment options that go along with what the goals of care are. And I teach you how to define what your person's goals of care are now and into the future. And then it's also about, I also teach what happens to people from a medical standpoint as they're aging, because people living with dementia oftentimes live for a decade or more, and they're going to have medical emergencies and need for unplanned care, just like everybody else. Issues with the heart, having appendicitis. I had a client who had appendicitis. People have the flu, people have
Sure.
pneumonia. They're just the normal things that happen to all of us as we age, but it's more challenging in dementia. So I explain how it could be and
S-
help
s-
people figure out treatment options.
So is the course, I thought if I read it correctly, it's something that you can do at your own pace.
Yeah, so it goes out, it does get delivered to you over 8 weeks because I try not to fire hose people. So it has a
Sure.
process. But after the 8 weeks, you have lifetime access to it. So if something came up, because often it does, you can pause and then go back to it. So the way I envision it is the way it works is you actually create a decision plan based on your person's individual risk for the decisions that you're going to be most likely to have to make. That's one benefit of it. But another thing is that it's actually access to a doctor explaining all of these medical problems where you can pause and rewind and go back.
So so let me ask you this. Is it something that I need to do as the caregiver, or is it a course that I can buy for my parents and say, "Do this, please?"
So the way that it's set up is for the decision makers of people living with dementia. I have had people that have somehow met me in my local community who have purchased it to use for their aging parents because I do teach like medical issues in general, but it is designed for someone who is speaking on behalf of a person living with dementia. Every single video in the course talks about how this is different in dementia. Could you use it to plan for yourself or an aging parent? Yes, you could. But that's not the intention of it. So I don't want to give any false pretexts that
Sure.
that it would help with everybody.
All right, fair enough. Your website had a ton of great resources on it, so I want to encourage everyone to go there. Let people know one last time, Brittany, how they can find you.
Yeah, I would just recommend that you go to blammd.com. And if you want a freebie, if you go to blammd.com/3 mistakes, you can get a guide for avoiding the top 3 mistakes as a decision maker for your person living with dementia.
Wonderful. Well, I will make sure to post that on my Facebook page. And when we come back next, I'll be talking with Allison Ronning, end of life doula.